Hi everyone, welcome back to my YouTube channel. Today we are going to talk about inferior nasal concha. So let's start our topic with introduction. Inferior nasal concha is a paired, curved, scroll-like facial bone that projects horizontally along the lateral wall of nasal cavity as you can see in the diagram. Unlike the superior and middle nasal conchae, which are parts of ethmoid bone, inferior nasal concha is an independent bone. Its primary function is to increase the surface area of nasal cavity, helping in warming, humidifying, and filtering of inhaled air. Location and structure of inferior nasal concha. It is situated on the lateral wall of nasal cavity below the middle nasal concha. It extends horizontally into the nasal cavity, forming the inferior nasal meatus beneath it. Each bone is thin, spongy, and scroll-like in shape. Parts of inferior nasal concha. It has two ends, anterior end and posterior end. Anterior end of inferior nasal concha is thin and pointed, and it is continuous with the maxilla. Posterior end is more rounded and it projects towards the palatine bone. Then there are two surfaces of inferior nasal concha. There are medial surface and lateral surface. Medial surface is convex and it is covered by thick respiratory mucosa that is rich in blood vessels, while lateral surface is concave and it faces the maxillary sinus. Borders of inferior nasal concha. It has upper border, lacrimal process, then it has ethmoidal process, maxillary process, and then it has lower border. Upper border of inferior nasal concha is irregular and it articulates with other bones. It gives rise to three processes that include lateral process, ethmoid process, and maxillary process. Then there is lower border that is free, thick, and curved, and it forms the visible edge of concha in the nasal cavity. Articulations of inferior nasal concha. Inferior nasal concha articulates with four bones. It articulates with maxilla, palatine bone, with lacrimal bone, and with ethmoid bone. Functions of inferior nasal concha. First function is air conditioning, as this bone increases the surface area of nasal cavity, allowing better warming, humidifying, and filtering of inhaled air. Second function is mucous membrane support, as this bone is covered by mucosa that help trap dust and microorganisms. Third function is olfaction support, as this bone assists airflow towards the olfactory region. And fourth function is nasal structure, as this bone helps form the inferior nasal meatus, that is a passage for air and drainage of nasolacrimal duct. Clinical significance of inferior nasal concha. First is hypertrophy of inferior nasal concha. If there is enlargement because of hypertrophy or any other cause, it can obstruct nasal airflow, thus causing breathing difficulties. Second is surgical significance, that is surgery of inferior nasal concha, that is called as turbinate reduction. It is done sometimes to relieve chronic nasal obstruction. Conclusion of this lecture video. Inferior nasal concha is delicate but functionally important paired facial bone. As an independent turbinate bone, it plays a crucial role in respiration, filtration, and humidification of inhaled air. Along with other concha, it contributes to the efficiency of nasal cavity and helps maintain respiratory health. And this was all about inferior nasal concha. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.